Well, the United States now has 3 vaccines, fewer than 50,000 hospitalized patients, and a drastic drop in new cases since the start of the new year. While this is all good news, it's important for people to not let their guard down. Chief Health Editor Dr. Partha Nandi joining us right now with more on the approval of the Johnson & Johnson vaccine. Dr. Nandi, nice to have you with us on this Monday.
Thanks, Carolyn. How are you?
Wonderful. So when can people start getting those shots?
Yeah, here's the thing, Carol. It's great news that J&J, Johnson & Johnson's vaccine, was approved over the weekend by both the FDA and the CDC. Now, distribution actually started last night. And as you said, 4 million doses are being shipped to states and territories. Now, the vaccine should start arriving Tuesday at some pharmacies and health centers, but it's a limited supply right now, right? So will not be available at every vaccine location. More will be delivered very soon. Johnson & Johnson has been ramping up production, and they expect to have 20 million doses delivered by the end of March. But what's more exciting is 100 million by the end of June.
A lot of people happy to hear that, Dr. Nandi. So with our case numbers leveling off at this point, are you concerned that we might repeat history and face another surge down the road?
I really am. You know, it's definitely a possibility. Now, Carolyn, we've seen this before, right? In the spring and summer last year, restrictions were eased up and folks were like, we got to get out of the house. And I get that, right? I want things to get back to normal more than anybody would ever care to know. But right now, we're at a critical point. Case numbers have dropped and plateaued for most of the U.S. But get this, in Michigan, we've had a 6% increase over the past 14 days. So I'm concerned that people are saying, hey, the numbers are down. That means I can go out and go hog wild. Or they may take more risks or ease up on safety precautions. Then that 6% increase, guess what? It'll go up and up. So we've got to remember that we have new variants, right? Remember the variants from South Africa, variants from Great Britain, you know, they're circulating in our communities. So they are more contagious and possibly even more deadly. So please, now is not the time to ditch the safety measures. Continue to social distance, avoid large gatherings, and wear masks and wash your hands as well.
Got to be careful. Now, Dr. Nandi, there are people who still prefer Pfizer or Moderna's vaccine over Johnson & Johnson's. However, the CDC has said Johnson & Johnson's vaccine will save lives and benefit the health equity. Can you explain to people what that really means?
Yeah, this really worries me. The best vaccine is the one in your arm, right? Number one. So we really need to stop comparing Johnson & Johnson's vaccine to Pfizer and Moderna's. Number of reasons why. The trials were done where they didn't have variants with Pfizer or Moderna's, whereas with Johnson & Johnson they did. So the efficacy rates are not always the same. And then Johnson & Johnson's vaccine will help save lives, in my opinion, because no one who got the vaccine for J&J died. So they had 0% death in their trials. Also was found to be 85% effective in protecting against severe disease, which is important to me because that saves you from getting in the hospital. As for health equity, Johnson & Johnson's vaccine is a single dose. Why is that important? Right? It also can be refrigerated at a normal temperature, easy to distribute. And so people with limited healthcare access, like the homeless, like those in the justice system, people who live in rural areas, and those folks who are homebound, very important. And the one dose makes it easier to vaccinate, keep people out of the hospital and out of the morgue. This is serious business. If you can get a vaccine, any of the 3, please get them and not pick and choose. So that, and then please keep the safety measures up. That's going to save lives.
Wonderful, wonderful. Dr. Nandi, we always appreciate your expertise and your time. Thank you for joining us tonight.
My pleasure.